Hello everyone, and thank you for joining us today. Before we get started, we have some logistics to go over. At the end of the webinar, there will be a question and answer session. You can ask questions at any point during the webinar using the QA function on your screen. There's also a chat function, which looks like a talking bubble with an ellipse in it. You can use the chat function to share questions, comments, and resources. You should see a message pop up from us just about now. So, happy National Public Health Week, everyone. We planned it so that we would be celebrating together with our final episode of the Leadership and Practice, a Digital Exchange webinar series, which is hosted by the Midwestern Public Health Training Center. These digital exchanges were created as an opportunity to learn about successes, challenges, and innovative approaches in applying the 5 themes of Public Health 3.0 in practice. Today's episode is Foundational Infrastructure, a focus on the public health brand. Our moderator is Sonia Armbruster. Sonia is a health science educator in the Department of Public Health Sciences, College of Health Professions at Wichita State University. Previously, she worked for nearly 10 years at the Sedgwick County Health Department, where she served in a number of administrative roles. She has presented and published on public health practice issues and continues to provide consultation at the regional and national level. So at this time, I'll turn things over to Sonia. Thanks, Sonia.
Hey, thanks, Kate. It's great to be with you all, and it's great to see everyone that I can see on the screen, and hope to hear from everyone who's participating in the webinar today. We're thrilled to have the Kansas portion be about the foundational infrastructure and a focus on articulating the foundational infrastructure and the public health brand. When we started looking at that, we realized that this week we had this wonderful opportunity that in Kansas we're celebrating National Public Health Week in many ways, one of them being attending our Governor's Public Health Conference this week. And part of our Governor's Public Health Conference is having an opportunity to have Peter Holtgrave and his colleague Eli Briggs from NACHO with us. And so they're going to be part of our discussion to talk about foundational infrastructure. Our other panelists today are going to be Shirley Orr and Dan Partridge. So I'll start with, and before I kick it off to Shirley, I wanted to thank our planning team members. In Kansas, we had a lot of discussions via phone and email about what did we really want to talk about as it related to Public Health 3.0. And our planning team members included Dr. Suzanne Hawley, Tanya Hondrick from KU, Tyson Wrench, and Christy Kane from KDHE, and our colleagues there throughout the Midwestern Public Health Training Center. So our panelists today are Shirley Orr, who is an associate for the Public Health Accreditation Board and has had a long and impactful career across Kansas and across the United States, helping health departments at both the state and local and tribal level better prepare for public health accreditation. And I'm thrilled that we have Shirley with us today. And with that, Shirley's going to help us begin to understand public health branding as a core piece of the accreditation board expectations. So with that, I'll pass to Shirley.
Thanks, Sonia. Just wait a minute here for our technology transition. While we're waiting for this to come up, I want to say hi, everyone. It's great to be with you during Public Health Week, even if it's only virtually. In the first segment, I'd like to spend some time talking with you a bit about the specifics of a branding strategy as a way that you can more fully achieve your goals in public health messaging. So in this segment, we'll take a look at the ways branding is incorporated in the FAB standards and measures for health department accreditation. And then also, I'll share with you one example of how one local health department has built their brand strategy to improve public health messaging within their agency. So branding is a pretty common strategy by now. It's been implemented by our public health partners as well as within the business sector with lots of good results. We're all familiar with the images that are used to distinguish our public health partner organizations, CDC, and also FAB. In the business world, there are many brand images that immediately are associated with specific products that are represented by the brand, even without a word being mentioned in their logos. Here on the bottom row are just 3 examples of companies who've managed to create an image that resonates very deeply with consumers and has contributed to their success. I'm guessing that you recognize these 3 companies. So what ideas, emotions, or experiences do you think about when you see these images? That's what these logos are intended to invoke. The companies are hoping that you think of consistently great coffee, pizza, and leading-edge technology. We all know how challenging it can be to communicate with stakeholders about public health, and specifically about the work of your local health department. Developing a clearly identifiable organizational brand is just one strategy to better address the challenge. In other industries and sectors, we see branding as an accepted way of increasing visibility, perceived value, as well as the reputation of organizations. Developing and promoting a brand helps to build broad awareness of the health department's role and value, and just how different it is from other organizations. Having a brand strategy is also an important way to help the health department build awareness and support to become a valued, effective, and trusted leader for health in the community. So let's talk for a little bit about how branding specifically is addressed within the FAB standards. FAB measure 3.2.2 is the measure that specifically speaks to the organizational branding strategy. The measure has two elements of required documentation. Those include the department's brand strategy itself, and also examples of that brand strategy being implemented. So even if you're not currently preparing for accreditation, I really believe that the FAB guidelines are an important way to have a framework to use as you look toward implementing a brand and really upping your game, so to speak, in terms of creating public health messaging. So for the first area of required documentation within the FAB standards, the brand strategy, there are 6 points that must be demonstrated within the strategy. First, the strategy must include efforts by the department to assure that staff members have a good understanding and commitment to the brand. The strategy itself must also convey that there's communication of the brand in a targeted way to the various stakeholders that you work with within the community. Additionally, your strategy should illustrate that brand messaging is integrated into your communication tools. That includes your website, media releases, PSAs, presentations, grant applications, and also promotional materials that are used by your various programs within the department. Another requirement is that the use of a common visual identity or logo that communicates the brand. Along with the need for a logo, the strategy must also address that there's appropriate signage both inside and outside of your building. And finally, within the branding strategy, there should be evidence that the department's brand strategy is linked to the agency's overall strategic plan. In terms of accreditation requirements, the brand strategy can be demonstrated through a single policy, or you could use a set of policies or strategies. And of course, all of those documents should be current and developed within the last 5 years. In the second element of required documentation for FAB accreditation, the department simply provides examples of implementation of its brand strategy. Some examples could come from the department's website, from media releases, PSAs, your social media activities, presentations or exhibits, grant applications, and promotional materials. 2 examples must be provided, and again, those should be current within the last 5 years. Just a quick word I'd like to add about logos. While branding includes more than simply using a logo, the logo indeed is really important. The use of a unique department logo has been a challenge, or it's been seen as a challenge by some departments, especially if there's a logo already associated with the parent organization. So the county organization, the state organization, or a super agency that the health department might be a part of. In these cases, it is appropriate to simply add an additional identifier, such as the name of the health department, your tagline, or something along those lines to that logo as a way to individualize that logo and make it unique to the health department. The public health logo that was developed a few years ago through NACCHO serves as a department logo when paired with an identifier that's unique to the health department. And here you see one example of how you might go about that. This is the logo currently in use by the Grand Forks Public Health Department in Grand Forks, North Dakota. So I'd like to share one example of how a currently accredited health department has undertaken the work in developing and promoting their brand strategy. We'll be talking about Spokane Regional Health Department in Washington State that serves a population of just under 500,000 people. While it's possible to implement a brand strategy through either a centralized or a decentralized approach, Spokane decided it would work best for them to move from a decentralized communication function to a centralized one. When the communications and branding work was centralized, dedicated communications staff led the work, and they provided templates, policies, and procedures that were used throughout the agency. The templates, policies, and procedures address the agency's overall communication strategies and tools, and that included the agency's website, its use of social media, email communications, intranet and internal communications, and also media relations. In addition, templates, policies, and procedures were also developed to address how the department handles its publications and social marketing campaigns, presentations, and collateral communications, such as brochures and other printed materials used by the department. The centralized communications staff also provided multiple training sessions to staff at all levels within the agency, and these address topics such as risk and emergency communications, social marketing, and social media, along with other forms of media. These training sessions reinforce for staff how the brand strategy conveys a unified message across the various programs and services that the health department provides. So what's happened as a result of the process for branding in Spokane? The department has some great preliminary evidence which suggests that the communication strategy and the branding work that it's implemented is paying big benefits. The department participates along with other county agencies in a county-wide survey that elicits data about some public perceptions of public agencies. Most recently, in the survey, 65% of community members rated the health department's performance as either excellent or good. The department also monitors public perception of public health through a quality of life survey. And in that most recent survey, 72% of residents indicated that they were aware of public health in Spokane County and that they were satisfied with the performance of the health department. As I mentioned earlier, the approach that was taken in Spokane is the approach that they felt would best advance communication within their agency. But certainly there are many other ways that you might approach branding that could be equally effective. And departments absolutely must consider what's achievable in their agency given their own resources. Spokane's communications staff believe that having a centralized, coordinated effort in branding definitely helped their agency achieve momentum. But in a department without dedicated communications staff who have branding expertise, it would certainly be beneficial to begin by providing training about communication and branding for all staff members, and also identify incentives for existing staff to serve as ambassadors for communication to help move forward with the branding strategy within the health department. As you do this, also making a clear connection between communication, branding, and the department's strategic plan is essential. Obviously, there's lots of benefits in doing this, among those fostering more open communication throughout the agency and building the department's overall communications capacity. Having better communications capacity will also pay a lot of future benefits in terms of better understanding and support for public health and the services that the health department provides. So as you explore the FAB standards and measures, you will see public health messaging embedded in several standards and measures across the entire framework of FAB standards. Having a defined branding strategy is essential as it helps to assure consistent messaging that conveys effective public health messages to the public and to other stakeholders. So at this point, I think I'll transition back to Sonia. Thank you very much, and I'll be happy to respond to questions that you may have in our final segment.
Thank you very much, Shirley, and I hope everyone is thinking about generating some questions on the Q&A and in the chat. Feel free to do that at any time. What we wanted to do with this webinar series was explain why you would even want to have a brand. That's an important piece of this work. Why you would want to have a brand, how would you get started, and a great local example. And thank you, Shirley, for sharing some of the examples that you've seen across the country and providing some of the background and rationale for why to have a brand strategy as a key part of the core moving forward of Public Health 3.0. We have this great opportunity to utilize some of Peter Holtgrave's time while he is here in Kansas, and so thank you for being with us. Peter is the Senior Director of Assessment Planning and Public Health Infrastructure Programs. He's a Senior Director at NACCHO, and he has a wealth of information that he's providing in a 4-hour workshop that he is sharing with you in 10 minutes. So I appreciate you taking the time and being a part of this, and I hope you will all save your hardest questions for Peter. Thank you for being here.
Well, thank you. It's really a pleasure to be here. Both Eli Briggs and I were delighted to have the invitation to come out and do this workshop and to share a little bit of some of what the participants are going through. But first I want to say how great it is, and really an honor to share this discussion with both Shirley and with Dan. Shirley really has been an exemplary person in terms of not her footprint in Kansas, but working with her collaboratively on the FAB standards and measures, just disseminating public health, and just in her leadership with the Association of Public Health Nurses is just outstanding. So she's been a great partner of ours. And then Dan used to be a member of our performance improvement work group. So we as NACCHO try to make sure that how we do what we do in supporting your work out in the field, if your local public health and your partners, stays relevant and is timely, and the resources are meaningful. So Dan used to be a member of that group for the past, I think it was 4 years, maybe even more, Dan, but in addition to the many hats that he has worn, I think it's great to share this discussion with him. So for those of you who don't know, we as NACCHO exist because of you on the ground in local public health and your partnerships. We exist to really try to channel what your needs are, funnel that to the national stage, and to really funnel resources and increase the capacity of local health practitioners and their partners to be able to do their work more efficiently, have greater health outcomes, and really to move the needle on population health. So just to be clear, when we're talking about in terms of this discussion, NACCHO engages in all these activities, but just to be clear, what we're talking about today is really that largest tier of these 3 circles. So we're talking about educating different stakeholders or audience members about what is the value of public health and whatever the concerns are, whether it's a disparity that needs to be addressed, or to make the case for why services that you're currently providing need to be maintained, for example, to those different audiences. We're not talking about trying to persuade an elected official, for example, or on a piece of legislation, which would be lobbying, or trying to advocate for particular positions such as funding, which would be advocacy. Though realize that we as NACCHO do have experts and staff that focus on all these areas, my contribution to the discussion and building upon what you've just heard shared by Shirley is really that informative piece that we as public health practitioners play and making sure that we build value and demonstrate value across different sectors. So when we ask the question, what does health mean to you? This is an example of a wordle that came out of some community health engagement activities out in Kentucky, with the words, of course, being more prominent, more frequently you see those words, everything is health. So tapping into that sentiment that whether it's how we eat, how we live, how we pray, the family associations that we have, everything can be really drawn back to this issue of health, and differentiating how the relationship between public health and health really should go hand in hand, and how we talk about the value of what we do as public health practitioners and partners. So here's an example. This certainly is not a comprehensive diagram, but this is just some way that we as NACCHO try to talk about really the constellation of services and roles across the close to 3,000 local health departments that they provide in terms of services. So everything from tobacco control to emergency preparedness to maternal child health, et cetera, we play some role in terms of impacting health outcomes. What's important is that keeping messages simple, to Shirley's point, and tailoring those messages to our different audiences is key to what we do, whether we're trained to do that. So for example, the local health department staff from across the state of Kansas that we're engaging with today, none of these folks are marketing and communication professionals. This is really just talking about some essential principles, tools, techniques, and knowing where to go for resources to be able to think about your key messages. We're all great at collecting data, but we don't need to oversaturate our case when we're talking to a local resident or an elected or appointed official, where all of that gets lost in the noise and our message gets lost. And so here's some examples of public health messaging that probably applies to any local health department. So we do connect with healthcare, but of course, health is more than healthcare. It's about the preventative services. It's about the things you might not concretely see, but it's all around you. So it's what happens beyond just within the doors of the offices of a doctor's office, for example. And so what we're really talking about is thinking really maybe outside the box of our usual stakeholders that we might think about, or the funders that where we receive resources to be able to do a discrete project. The local public health system is seen through this this jelly bean diagram. You know, this is obviously much more complicated than this, but the audiences we need to think about in terms of either swaying them to our side or honoring that they do play a role in terms of community health and population health is quite integral to what we do. So it's beyond just how we message with our elected officials or the hospital system or the community health center network. All key components and partners in what results in the health outcomes in your local communities. But it's much more diverse than that. It's housing, it's transit, it's the faith-based community, it's the immigrant organizations, the advocacy groups to keep in mind. And just to briefly talk about this issue of stakeholders. So when we talk about stakeholders, it's not just funders and the elected officials necessarily, it's anybody that currently does or could have a role in the success and the viability of what you're trying to do as a local or state health department. So one way that we can think about this is a classical 2x2 table of thinking about how much influence do they have, power if you will, versus how much effort will it take to really engage them and to sway them. So you can kind of see one way you can map or plot them is this by a simple 2x2 table. What I'd rather talk about in more detail, however, is nature does a lot around change management and what we call adaptive leadership. So often what we face as public health practitioners are structural challenges. We kind of know what needs to happen and we implement those steps based upon our expertise. But I would say, especially when it comes to talking and communicating the value of public health, it's often the relationship-based things, the below the neck type of challenges that are based upon the values, loyalties, and losses that we need to be considerate of is beyond just communicating and educating and giving facts. We need to think about what motivates the people that we're trying to persuade to understand the value of what we do as public health practitioners or the issues that we're trying to champion. So what we mean by this is, for example, the values would be thinking about who their constituents are. If they're elected officials, are they worried about what were they mandated to do based upon the voters? What risks do they perceive in sanctioning or pooling resources or championing in some way what local public health is? What has been their track record? So sometimes mapping out who are the other audiences they're loyal to, as well as what their personal and appointed values and sense of loss risks can be, are as equally important as just identifying who those stakeholders could be. So one way of doing this is, I'm sure many of you are already familiar with doing some stakeholder analysis and mapping. This diagram is meant to talk about ways of engaging folks in terms of messaging. So the way to think about this is that whatever your public health issue is, you have to think about who are your internal stakeholders, meaning who within your health department has the capacity, and maybe you have to think about what the workforce ramifications are around crafting these messages or their ability to disseminate these messages. And it might not be internal stakeholders, it could be external partners. For example, if you're working with the United Way or YMCA or with a hospital system and they do have increased capacity to develop these messages, who can you align with to be able to make sure that you build up sufficient capacity to get these messages out. For those of us with health departments that have 5 FTE or less, often we have to play multiple roles around that, so it's important to think about those things. And a way to think about primary stakeholders. So primary versus secondary just means they're really essential to your success as a health department. Is it the state health department from which you get resources? Is it a funder that you're getting to be able to offer your WIC programs or your MCH programs? Is it the Board of Health? Is it the mayor's office? The secondary stakeholders would be those that could contribute to your success, but they're not maybe tied directly to the survival, if you will, or to the success of what you're doing as a health department. So those could be, and make sure that you're thinking about residents throughout this process. That's why they're kind of cross-cutting, is having the voice of your local communities or your constituents as a part of trying to think about what messages resonate with different folks. And the method of communication, if you reflect back upon Shirley's list, I think is equally important. And then tertiary stakeholders could be those that, you're not quite sure what role they could have in adding value to what you're trying to do, but keeping them informed, maybe not as frequently, maybe not to the extent or the duration of your primary and secondary stakeholders could be, keeping them informed in some way, because you might win them over based upon the alignment of interests, and again, of those values, loyalties, and sense of loss, and the combined efforts and priorities within your community that really resonates across those different stakeholders. So something I can follow up on with this webinar is we actually have additional resources that help you map out this idea of internal, primary, secondary, and tertiary audiences. But I also just want to quickly mention that we often are very comfortable as public health practitioners collecting lots and lots of data. Often it doesn't move to many places, maybe to the funder, maybe you're feeding a state-based system, what have you. But this idea about leveraging that expertise to pull data from different sources, to triangulate them, if you will, to be able to tell that story is equally important. So is it an elected official has no idea about what public health statistics mean, so therefore telling the story through pictures with some key highlighted data points is important. A lot of us have become much more fluent with using secondary data to use GIS mapping to talk about the prevalence and the need of different health indicators and disparities. So drawing upon that expertise within your health department, I think, is key, both the locally sourced information that you have as well as the secondary data, such as the county health rankings, where you see a map of Kansas on the top there. Hopefully, many of these types of national sources are known to you, but this is just a sample of different types of secondary data that you can use as benchmarks to be able to compare what you're collecting locally, to be able to make the case for the disparity that you're trying to meet, or to really help justify that you really are showing some moving the needle on the outcomes, and hopefully at some point the impact of the services that your health department is providing. Here's an additional set, especially for folks who are in more rural settings. The Rural Health Information Hub is a key, an important resource. TIFA, the Trust for America's Health, is quite good. Policy Link that you see on the right-hand side is a good example of ordinances and policies that you can see examples of, as well as other resources for informing policy. And then we as NACCHO, one of the primary roles that we play is collecting data from across the nation. We are the foremost authority of local public health data from a national perspective. So for those of you that participate in our biannual National Profile Local Public Health Survey, just called Profile, as well as our Forces of Change survey, which is every year in between, are often seen as key sources of data. So if you don't know about them, you can go to the links on the that you see on this screen that we'll share afterwards as well, or just Google Profile and NACCHO, and you'll see a series of historical data that really paints the picture of the current reality and the recent reality of workforce issues, governance structures, public health issues of concern across the country, and then what are the forces of change that local public health is facing, kind of looking at today as well as moving forward more prospectively. The impact of Zika or funding changes or anything that could be of strong concern. You can reference these different types of documents or repositories of data and compare where you are at as a local or state level health department, working also with EFTA's profile, to be able to inform your own priorities and maybe make the case for the types of messaging and causes that you're trying to champion. And of course, here sitting in Kansas has, I think, one of the most robust state-level public health repositories of data. So hopefully within your state you have something similar where you can produce kind of like county health rankings from RWJ, data that can be stratified and represented graphically, et cetera, hopefully down to the zip code level, for example, is important to be able to address, again, the disparities or health issues you're trying to champion. And I just want to end quickly with some other additional resources. You can go to NACCHO's website as well. Feel free to reach out to me as well to be able to triage even more specific questions. But we have lots and lots of communication and marketing tools and resources that talk about how to do tweeting and free messages for tweets, to Facebooking, to branding and marketing guides, to the point that Shirley was making in terms of not just for FAB standards and measures, but for other concerns. And we also have a lot on our advocacy side. So again, on our non-government funded side, if you just want to get our updates about what is happening at the federal level in terms of legislation and ways that will help to bolster your voice in terms of informing elected local health officials, for example, or even state level, I would recommend that you also sign up for some of these newsletters to stay informed. So I thank everyone for having had this opportunity. Happy to answer questions, but make sure you jot down my contact information. I'd be glad to follow up with some additional resources if that's helpful to you.
Thank you very much, Peter. So we started out with Y brand, and then we transitioned to how to get started. Thanks to Peter. And now we're going to take a great look at a local example that is very strong. So our colleague Dan Partridge is the director of the Lawrence Douglas County Health Department, the director of the Lawrence Douglas County Health Department. And Dan is a progressive public health leader in our state and across the nation. I know of 4 NACCHO Model Practice Awards that department has earned under Dan's leadership, and they've done some really progressive work around public health and public health communication specifically. So for that reason, we reached out to Dan and said, would you please share a little bit about the story about how you've done it and some of the things that you've done? So I pass to Dan.
Thank you, Sonia, very much. I appreciate the time you've given me here. And I'm going to really speak fast because this is an 11-year journey I'm going to take you on. I got here 11 years ago, and this health department was well known for excellence in clinical services, excellence in the leadership that was present at the health department. So this has been a strong health department for decades. But my vision was we needed to be a different kind of health department, one that was out in the community as much as it was inside our clinic. And so we started by having all staff and our health board create our story. And to me, that has been a bridge and a leaping off point for staff and the community to talk about this journey and this change to being in community. So our story talks about our past, our present, and our future. And just to cut it short, I would say that future story, which is about a half a page long, is really that Cliff Notes version of our strategic plan, where it says that the things that are most important to us are getting better every day, using data to provide actionable information, and driving health equity in our community. Those things stand the test of time. And there's something that we give to each employee as they start here. It's day one when they sit down with me to kind of get 30, 45 minutes on the vision and mission of the health department and the purpose that why we exist. It's their homework assignment so that they can go home and tell their family what a great work the health department does and why we do it. Shirley talked about Spokane and moved to a centralized kind of way of branding. And I would say we do it both ways. We have a centralized process and a decentralized process. What I spoke just now, to me, talks about that very well. It's a centralized process in that we all came together, we created a story, we stick with it. It's been the story for 11 years. It's decentralized in that every staff member is expected to own it and share it. So this is a shared job. In fact, we pay attention to our social media, our communications out, and we make sure that every staff member is either verbally, in writing or in a picture present each year in the work that we do. The public doesn't know that, but our staff do. And so it's a way to send that message that this is everyone's job. So that takes training, it takes emphasis, it takes, our communications coordinator really sitting down with each person, and she does that to, not only in that first week when they're here, but every time as we, get asked by the media to talk about something. We're asked by the media on average about every other day to provide content. So for us, our brand is spread mostly through earned media. And we never turn down an opportunity to write a story for another organization like the hospital or the Chamber of Commerce or the Parks and Rec Department. So we're ghost writers for many other organizations as well. But back to that 11-year journey a little bit. We needed to change how the community thought about us. We just do really great clinical work to we're out in the community helping people and organizations make decisions that benefit their health. That's what we see our purpose being. And so to do that, accreditation is a great vehicle to make that transition. And we needed to know why we were going to pursue accreditation. And the why for us was it was a means to an end, and the means to provide better services, higher, better health outcomes for our population. So that was our accreditation story to the community, was we're doing this for you. In that journey, we asked the University of Kansas, who's our neighbor here, to help us brand and create new marketing strategies for this accredited health department. And so we worked with some senior level communications students at the university, took them around the country to try to learn from others. Our first trip was to DC and NACCHO to learn about marketing from NACCHO at a national level. And to boil that all down, the outcomes that came out of that were a tagline of healthier together. Everyone can remember that. And so we put that into everything that we do. The other thing that came out of that was when you go and you visit about 10 different, take 10 different trips and see about 15 different health departments that we thought were high performing health departments. And we came back feeling like, what, we're doing just as good a work. So it was affirming in the sense that, health departments in the middle of the country that aren't as resourced as others, we can still do a good job. So we took that from it as well. So we continue to, and I guess the last thing I would say that stuck with me from that experience was the learning that you don't get to decide what your brand is. The public decides what your brand is. You help frame that every time you interact with the public. So back to every staff member here knows that it's their interactions with the public that shape our brand. And late last year, about October, we started a different kind of feedback system for us, where we ask every single client at every visit what they think of us. And we ask them 4 questions. Did we treat you well? Did we provide helpful services? Did we give you information you can use? And would you recommend us? And everyone, we got 97% or greater agree or strongly agree responses from over 1,100 clients. And so to me, that speaks to, that doesn't happen without every staff member just really going above and beyond with every single visit. So that would be my takeaway for you is, make sure that every staff member owns the branding message. I think I'm about running out of time, so I'll stop there.
Well, thank you, Dan, for telling your powerful story of working with unique partners like KU and the students there to build a branding strategy and a tagline. And thank you for sharing this idea that we have to build that brand by framing the message, because the community is going to build a perspective, and we want to help frame that. And that utilizing all of your staff is the way that you're able to do that. It can't just be one person's job. We're all helping create that story. So thank you for driving those important points home. We're now at the part of this webinar that is the digital exchange piece. So I want to encourage everyone to ask questions or add something to the chat. The first thing I'd like to encourage everyone who's participating to think about are, what are some actions you've taken to help your workforce build their leadership capacity to tell that public health story? So are there actions you've taken that are helping train them? So one of those key 3 or 5 foundations in Public Health 3.0 are about workforce development and leadership. So how are your organizations, and how have you seen organizations strengthen the capacity for staff to tell a good public health story? And so while you're all adding something to the chat, which I'm hoping will happen, I pitch that to our panelists here. In addition to some of the examples that we've shared, how do you see people developing that? Shirley or Peter?
I think there's lots of ways to do that. One way that I think is a very practically oriented way is to, during a staff meeting, a training or something, give people a chance to actually think about their own story and to think about how they might communicate that to others. Many organizations have an elevator speech where they communicate with the public and partners about the work that they do. So perhaps a good way to get started is to ask people to think about how they might add a tagline to that elevator speech about their work at the health department. You know, what it is, why it's important to them, and why they choose to work at the health department as opposed to any of the other many employers that they could choose in the community.
Yeah, and what I would just add to that, so this is Peter with NACCHO, is in addition to, so we're the trainers and the capacity builders. So like, shout out to Dan and thank him for referencing that we do train people in this space and have resources about it, but I'll just give some additional examples that we've seen. So even we as NACCHO, we do kind of have our own tagline, and it's in every email. So having that be consistent. And we have a person that reminds us, hey, whatever the upcoming event is that we are playing a role in, that we want to promote, having that within every email is just a quick and easy way of disseminating information. And then this idea of stories from the field. So we have a website that's, if you just Google stories from the field NACCHO, that goes by different topic areas. If you want to see the lessons learned and the best practices on different topic areas within the realm of public health, that you want to see that other health departments have doing, just to maybe inspire you to do something that's a couple paragraphs long. Dan had mentioned that he never turns down an opportunity to write up copy for the partners or other opportunities like that. I think that's an excellent idea, and you don't need to be, again, a marketing communications major to focus on these things. But being able to contribute to blogs, to write there's some county health departments that do a bi-weekly column within their local newspaper, for example, on a relevant public health topic. So anything that you can do to kind of keep the awareness of what you do and kind of translate that into a way that's understandable to the residents that you serve, I think are great opportunities.
Dan, could you just speak briefly about how you've continued to train your staff? You said that everyone meets with you and they come on as a new member to learn about the mission and the vision, and you challenge them to go home and talk to their family about why the organization they've joined. How do you keep that front and center for staff to know about the story or be cognizant of their role in helping tell the story?
Well, I think it's repetition. You know, we're marketing to staff every day. That's the first thing that comes to mind. The second is I go back to that we're in the paper or on the radio or in the television on average every other day. And Carrie Britt, our communications coordinator, she sees her role as air traffic control. She connects that media to someone here. So people get lots of practice. We probably have a fourth of our staff who are being interviewed at least once a month. So they get lots of practice.
That's very helpful. All right, so the challenge to participants in the webinar is to consider ways that you could add a question in the chat or in the Q&A to add your ideas about how you have strengthened the capacity of your leadership. A second thing that's part of this foundational infrastructure piece that was listed in the report, and it's on page 26 of the 3.0 white paper, is about cultural competency as part of that foundational infrastructure, and thinking about how do we develop communications campaigns or efforts to sell and tell our brand and our story that are through a health equity lens. And what are some of the ways that people are going about doing that? I know when we were talking last week, Dan, you mentioned one strategy that you're doing, and invite you to share and others to talk about how you're getting that equity story and telling the full story of your community.
So one resource I can highlight, just because we curate this site, is called the Roots of Health and Equity. It's a free online e-course that's really designed for public health practitioners. So the idea behind the course was funded by the California Endowment, Kellogg, as well as currently HRSA. HRSA staff actually go through the course as part of their professional development to inform how they do what they do with grantees, which I think is just a great story. But essentially, it's a 5-unit online course that really tries to unpack what do we mean by health equity, how do we develop a shared language, and how do we address it through the different roles that we play as public health practitioners. So I just throw that out that if you just Google Roots of Health and Equity, that's a site that continues to evolve and grow. If you're familiar with the different webinar series that focus on health and equity issues, such from California Newsreel, for example, like on natural causes, it was produced with the same organization. So there's a facilitator's guide, even if you're not an expert around all things health equity. So it's really meant to generate discussion among your staff, partners, et cetera, about what does health equity mean to you and how do we apply that to practice. And I can pretty much guarantee that those discussions will give you the talking points, or at least the content that will help inform the messages that we're talking about. But that's just one resource, just because we're the most familiar with that. I would say that other practices like BARHI out of California, the Bay Area Regional Health Improvement Initiative, I probably screwed up that acronym, but they have a wealth of resources about how through an assessment and planning process to address health equity, but they also talk about messaging to different audiences as well around health equity.
Thanks. Dan, you want to talk about how you encourage cameras?
I didn't get the last bit of that. What'd you say?
Talk about how you want to make sure cameras are present at all your events.
Oh, well, sure. I mean, that goes to social media presence. And if you don't have content, you're not going to have followers. You're not going to get likes. You're not going to get activity. So, you know, that visual picture is you know, that drives everything. And so we kicked off Public Health Week yesterday, went around, gave everyone a thank you card and a t-shirt that branded it, and got our tagline on the back. And we got plenty of pictures out on social media about that. You can go like us and follow us. On the equity piece, if I could chime in there real quick, we brought in, because we had the opportunity of some federal funding, Policy Link for a couple of community trainings, and they were very helpful in getting us started. And we've since hired what we call a community liaison individual, and so now we attempt to, whenever we work with groups, and we work with lots of them, to try to figure out a way to get equity training into each of those collaborations that we're part of. So
Thanks for that good idea. All right, so I'm looking for questions, and I'm looking for concerns that folks might have. So I see a couple of questions that have, one of them, and this was on our list. So what have you found to be the best tools for getting your audience to provide feedback and get engaged in your story? So thank you for that question. What are some tools for getting audience feedback and get engaged with your story? So question to the group. And
that's a great question. One thing it brings to my mind is a campaign that I saw done through APHA not too long ago, with little stickers that were placed in many locations around the community about "This is public health." So I think doing something along the lines of that, or even just simply asking partners, those with whom you work, to share some thoughts about what public health means to them and how they see public health connecting with their work. One thing, and this relates a bit to the last question, I think, about health equity, oftentimes we don't realize how impactful we can be in helping the public to more fully understand health equity and public health, especially in the area of social determinants. So really elevating and showcasing the work that you do with education and letting people know, yes, a good education is the foundation for health in our community. With housing and sharing with people, yes, having safe, affordable housing is critical to the health of the people who live in our community, and it makes them healthier. So those are just a few ideas to get more voices to the table and into the discussion.
The only thing I would add to that is what we try to do at NACHO is whenever someone reaches out for a technical assistance request, for example, with my team, is following up with an email that's basically just a quick SurveyMonkey/Qualtrics, basically customer satisfaction survey. So the more that you're able to, as a health department, automatically send them some kind of a link or a survey, or even have that be part of a tagline, part of your tagline content, I think it's a quick and easy thing. That doesn't address the people who don't have, internet, for example. I think that anyone who engages in a chat chip process, that's part and parcel of what you should be doing, is creating a forum in person, hopefully through episodic events that you're a part of, as well as through other methods, to give people an allowance or a space to be able to give some feedback. And then wherever people receive services, if you're able to have some kind of a comment card or an ability for them to communicate in an easy way, that's something that's an additional lift on their end. Whether it's with your community health center partnerships, hospitals do this very well because it's tied to their price Gini scores and their reimbursement. I think whatever is feasible within, whether it's the technology piece or the funding piece, there are definitely lots of examples that we could share with folks around how you could gauge customer feedback and satisfaction on different issues.
I would say,
Thank you. We have a few. Go ahead.
You just need to ask and make it easy. For example, every clinic room has a tablet that's dedicated to having our SurveyMonkey up, and that's how we get 1,100 responses in a little over 2 months. Is it's a 30-second, SurveyMonkey on a tablet, and then they're done.
I think this idea of any client interaction, client can be defined as patients, or client could be defined as people who've emailed and asked a question, or you're working with on a coalition, asking and getting regular feedback. I mean, do evaluations of your role with coalitions, et cetera. But also, like the example that Shirley gave from Spokane, where they did a community perception survey to ask about how they are engaged with the public health department. I know the Tulsa Health Department does the same thing, so there are ideas like that. A couple more quick questions before our time runs out. One question was, can you share strategies to gain airtime on TV or radio for PSA messaging? Dan, you talked about the power of earned media. Thinking about really earned, like PSA, suggestions about that?
Well, you have to start with your audience. What do they want to know? What's interesting to them? Oftentimes you need to reframe your story from one that's interesting to you as a public health professional to one that's interesting to the general public, which means oftentimes you need to maybe rewrite the press release so that you get that more public perspective out there.
Yeah, and I would just add, this is Peter, that radio is a lot easier because they tend to have a little bit more of a capability for granting you that time. So public radio in particular, and TV to a certain respect, if you cultivate those relationships, they are often looking for that local lens to be able to present some information, and that's part of kind of their nonprofit status, ability to reach out to the community. So I'd say that take advantage of those. TV can be a little bit more challenging. There are some, I'm just thinking from my time in St. Louis, there were some local TV stations that will do every Monday, for example, as part of their morning programs, they'll do kind of an ongoing segments. And if you're able to create enough kind of plug and play content that's more evergreen, if you will, as opposed to something that's just hot off the press, if you will, they are often looking for, quote, filler information. And the more you present that to them in advance and think about what that could look like for their scheduling, creates those kind of opportunities.
And the only thing I would add to that is, like so much of what we do in public health, the success is often dependent upon relationships. So if you're not already friends or blooming friends with your local media, the newspapers, radio, TV folks, get to know them and take them out for coffee and make sure they understand what you're trying to do with your public health messaging. And then also don't get discouraged, because honestly, you may have a super duper event going on, something that you just think this is so newsworthy, but if it's a big news day, it may not simply make the cut. So do it early, do it often, and know that much of what you do will get picked up, not all of it, but keep doing it.
This could also be an example of how you lean upon your boards of health or their county board, whatever your governing structure is. Sometimes you might not have those relationships at first, but they might in different ways. It's kind of like that circles of influence. And so lean upon those relationships as well, especially if they're already advocates of public health to see if you can cultivate those in a more meaningful way.
Another question or comment in the chat was about the fact that it's possible that as we think about our public health field placements and how we work with students, that we might need to be working more beyond the public health students and with social media and marketing communication students as well to help continue to build our public health brand. I know that we're coming close to time, so I want to thank our panelists, Dan and Peter and Shirley, for sharing your expertise. Kate is, I know, wanting to give us some final closing thoughts. So thank you all for participating and considering brand and communications and messaging as a core piece of the future of public health.
Thank you all. Thank you to our panelists and our moderator for such a great final episode to our series. And thanks to all of you for joining us today. In a few days, you'll receive an email with the links to the archive webinar and a quick evaluation. The whole series is going to be archived on our website, www.mphtc.org, and we'll have some additional Public Health 3.0 resources. I just want to say thank you to everyone who made this series a success, and please keep a lookout for more series like this from MTIC. I hope everyone has a great National Public Health Week. Thank you.